Good afternoon, everyone. This is Dr. Val Arkush. Today is Monday, May the 18th, and I'm here today with our Montgomery County COVID-19 update as we now enter the 11th week here in Montgomery County since we have been dealing with this disease. Since our May 16th press briefing, we had 74 new cases of COVID-19 reported in Montgomery County on Sunday, May the 17th, and 99 new cases of COVID-19 reported today, which brings us to a total of 5,963 cases. Of these cases over the last 2 days, 46 are from long-term care facilities and 127 are from the community. These positive individuals are from 36 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 5 months to 101 years old. And as always, you can check our county maps at montcopa.org/COVID-19 for updated geographic information. Today we have 91 females and 82 males. We know that 3 are hospitalized, 8 are being cared for at home, and 162 we do not have information on. I'm also saddened to confirm that 55 more Montgomery County residents have lost their lives to COVID-19, which brings us to 529 deaths confirmed positive from COVID-19. 32 of these individuals passed away in April. I'll say that again, 32 of these individuals passed away in April, and 23 of these individuals passed away to date this month in May. Obviously, this was the result of a reconciliation of a number of probable deaths and other deaths that were reported late, but these are now our most current confirmed positive numbers. Of this group of 55, 25 were known to pass away at a hospital, and 30 were known to pass away at a long-term care facility. They ranged in age from 48 years old to 96 years old. Overall, we've had 285 females and 244 males pass away from COVID-19. The self-reported racial breakdown: 13 Asian, 3 Asian Indian, 2 Asian Korean, 55 African American or Black, 159 white, and 297 we have no information on. In terms of probable deaths, and again, as a reminder, these are individuals who pass away under clinical circumstances that are consistent with COVID-19, but it has not yet been proven by a test. We have 155 total probable deaths. So that is added to our 529 confirmed. It gives us a total of 684 either probable or confirmed deaths from COVID-19 in Montgomery County. In terms of hospital beds, the news continues to be good. We are continuing to see a slow but steady reduction in hospitalizations. Today, the number of hospitalized COVID-19 patients is approximately 250, with approximately 25% requiring ventilators. So we've made progress in both of those numbers over the last several days. In terms of our long-term care facilities, we still have 94 facilities that are reporting positive cases of COVID-19 among their staff or residents. And since this began and since we started asking these facilities to self-report, we've now seen a total of 1,682 cases among residents and 612 among staff, for a total of 2,294 individuals. Again, as a reminder, not all of these individuals are considered Montgomery County residents, so these numbers do not add up or add into our earlier numbers that we reported. 461 of the 529 confirmed positive deaths of Montgomery County residents, or 87%, are from long-term care facilities. We continue to do outreach with these facilities. Our FAST teams are making additional visits this week, as well as revisiting some places where they were a couple weeks ago. We are working with them to help meet their needs and answer questions, provide personal protective equipment, strategize with them on testing. We are very pleased to announce that the Pennsylvania Department of Health, in collaboration with the Center for Disease Control and the National Guard, will be deploying multidisciplinary strike teams for a comprehensive assessment to a small number of long-term care facilities in Pennsylvania within the next 2 weeks. These strike teams will be prioritizing facilities with early and recent outbreaks of COVID-19. At this time, there have been 4 facilities located within Montgomery County that have been identified for assessment by the strike team. Our FAST teams will be working collaboratively with these teams, and we are grateful for their support. It's my understanding that these teams will come in, they will do an initial assessment, and then they will help facilitate testing for all the residents and staff in these facilities a few days later. So it's great news to have this help, and we are very pleased to receive it. The update today from our Montgomery County Correctional Facility: we've had 1 additional inmate who has tested positive for COVID-19, which brings our total to 178. All inmates that have tested positive are currently in stable condition. Since the President Judge issued the initial March 12, 2020 order declaring a judicial emergency, the population in the Montgomery County Correctional Facility has gone from 1,342 to 876 today, a net decrease of 466, which is a 35% decrease. The average number of daily commits into the correctional facility is now 3 to 4 per day. This compares with an average of 28 per day before the March 12th order declaring the judicial emergency. Things continue to go smoothly at both of our community-based testing sites. The Norristown Walk-Up Community Site was open today and will be open each day this week, Monday through Friday, weather permitting. Many thanks to the Delaware Valley Community Health Center for all of their wonderful collaboration in this effort. Starting today, the testing site at Norristown Regional has expanded their criteria to include all residents of Norristown Borough and all established patients of Delaware Valley Community Health Center, regardless of which municipality they reside. Tomorrow, you can make an appointment for tomorrow, starting at 8:30 a.m. by calling 610-592-0680, and that's for the Norristown testing site only. The Montgomery County Community College drive-through site also up and running smoothly today. And again, many thanks to the community college and to Whitpain Township and their police, and the National Guard. The Pennsylvania National Guard continues to be extraordinary, and all of our county departments that are assisting with this work. From the dates of April 16th to May the 13th, we've now tested 5,855 individuals at that site. We've received results in 5,307 individuals, which represents 90% of the total. 670 of these individuals are positive. So for 23 days, we are running a 13% positive rate. Actually, that 670 number may not be the most up-to-date number, but we are still running around 13% positive. The appointments for Tuesday will open at 8 a.m. Tuesday, and appointments can be made at moncopa.org/COVID-19 under the green County Testing Information button. Or you can call 888-631-3000. I also want to announce another location for testing in Montgomery County. Testing is now available at the CVS located at 840 South Valley Road in Lansdale. This site will conduct testing at no cost. Health insurance is not required, but will be billed if you have it. This site is a drive-through only and will require you to self-swab your nose, but they will show you how to do that. To see if you qualify and to make an appointment, go to www.cvs.com. Scroll just a little bit down that page and you'll see a box that says COVID-19 resources. Click on that and you'll be directed to all of the information. So today we have a new graph for you. I'll let that come up. So this graph shows each day that a Montgomery County resident tested positive for COVID-19 at any location, and that is represented by the gray bars. And the 14-day and 7-day running averages of those totals represented by the lines. So the red lines show the total number of cases. The darker red is the 7-day total, and the sort of lighter pinkier red is the 14-day running average. The blues represent cases from the community. So the darker blue is the 7-day running average, and the lighter blue is the 14-day average from the community. And then the orangey lines represent long-term care facilities. So the darker, more orange line is the 7-day average from our long-term care facilities, and the more yellow line is the 14-day average from the long-term care facilities. The black dotted line, it represents the 50 cases per 100,000 residents. That was one of Governor Wolf's metrics for considering moving our county into the yellow zone. You can see that we continue to have a downward trend in these numbers. I want to just emphasize again that this downward trend is the result of the many, many personal sacrifices so many of you have made over these last number of weeks. We are continuing to meaningfully reduce the numbers of new cases in our county. But given the amount of virus still in our midst, without continued social distancing, these numbers could quickly change and move in the wrong direction. We are getting closer every day. Please continue to stay the course. Every single person's actions, particularly someone who is positive and doesn't know it, can prolong our readiness for the yellow phase. And so that brings me to masks. I want to remind you that you are wearing a mask to protect others and to give yourself modest protection from someone else who is not wearing a mask. Masks must cover your nose and your mouth to be effective. You might remember when there were just lap seat belts in cars. And then researchers figured out how much safer it was for you when you wore a lap belt combined with a shoulder harness. Wearing your mask so that it only covers your mouth is like just having that lap belt in your car. Wearing it covering your nose and mouth does the most to keep everyone around you safe. So please cover both. Treat your mask as contaminated when you remove it. Take it off from the back and put it in a bag or set it in a location where you won't contaminate your home. And finally, please wear a mask. This is about having respect for your community and respect for those individuals who might be fighting cancer or are otherwise immunocompromised, but they still need to buy groceries. They still need to go to the drugstore, and they still need to put gas in their car just like you do. So out of respect for them, please wear a mask. I don't believe that either of my colleagues have statements today. Is that correct?
I do, Commissioner Arkush. This is Joe Gale.
Okay, go ahead, Commissioner Gale.
Thank you. And good afternoon, everyone. Thank you for listening today. I wanted to provide an update on my weekend. This weekend, I was honored to join several members of our community and members of Conshohocken VFW Post 1074 to pay respect to fallen war heroes by placing American flags on the graves of veterans at St. Matthew's Cemetery in Conshohocken. This event was organized in response to the two majority Montgomery County Commissioners' refusal to release American flags for distribution at cemeteries and recognition of those who paid the ultimate sacrifice for our freedom. It was a very humbling experience to see neighbors come together to honor local heroes who made the ultimate sacrifice for our country. I had the opportunity to see many gravestones with last names of local families who still live in our area. It was heartwarming to see descendants have the opportunity to place an American flag at the gravesite of their own ancestors who served our nation. This solemn event was made possible due to generous donations of private charity from members of our community so that this local VFW could raise the funds necessary to purchase American flags. I would like to express my gratitude and thank everyone who made this beautiful memorial for our veterans possible. Whether it was individuals who generously made contributions, members of the community who helped place flags, the leadership of the VFW, and also 6ABC who captured this story for others to see. I thank you all. I'm humbled to help lead the effort to make sure our fallen military men and women receive the proper recognition they deserve. As we are now 1 week from Memorial Day, the patriotic efforts that took place in Conshohocken have inspired many other organizations to do the same across Montgomery County. I look forward to continuing to support these efforts to make sure our fallen veterans are shown the respect they deserve on Memorial Day. Thank you, and with that, we'll turn it over to the press for questions.
All right, any questions?
No questions today.
Okay. I do just want to take a moment because I think it's particularly important, and I am putting on my doctor hat when I say the following. Commissioner Gale is known to have had direct exposure to someone who is confirmed positive with COVID-19, our colleague Commissioner Lawrence, who thankfully remains asymptomatic. Commissioner Gale has publicly stated that he refuses to be tested, and I have no evidence that he has been tested. And during the event that he just described to you, Commissioner Gale, and this you can watch it for yourself on the television, he was at this event. He did not have a mask on. He was personally handing a number of individuals who are older age and at highest risk from a serious complication from COVID-19. He was personally handing them flags with no gloves on and closer than 6 feet to them in order to hand them those flags. So this is not a comment about veterans. This is not a comment about lack of respect for veterans in any way, shape, or form. But Commissioner Gale should still be in quarantine. Having not been tested, he should be in quarantine for 14 days. And I just want to urge others not to copy this type of behavior. If you've been directly exposed and you know it, you should be tested if possible, and you should quarantine until you know you're negative for a period of days, at least a week. And as we are doing, try to stay quarantined for 14 days if possible. And certainly should not be out without a mask on, without gloves on, and not maintaining social distancing. So I would urge everyone to please be responsible, to please look out for all the people in our community. Any one of us could be positive, not have symptoms, but be contagious. And so in order to get to the yellow phase as quickly as possible and not suffer any setbacks on this good path that we have established, I beg you all to act responsibly and just assume that you could be carrying COVID-19 and that when you are out in public, for the protection of others, wear a mask and please follow all the social distancing guidance. Thank you very much. Taking those steps will be the thing that gets us to the yellow phase as quickly as possible. So thank you everyone for listening today, and we will see you tomorrow at 3. Have a good afternoon.
Excuse me. This is Commissioner Gale. Commissioner Arkush, you can mass shame me all you want. I'm not going to sit here and be bullied for honoring fallen veterans. It's enough already with the mass shaming, the mass bullying, and creating mass hysteria. You don't need a hazmat suit, gloves, and a mask to put American flags outdoor at a cemetery. So what you just said was ridiculous, and I want to connect the dots for everyone at home who's listening. This lecture today we received from Commissioner Arkush about the virtues of mandatory mask wearing are a passive-aggressive shot at me for honoring veterans at St. Matthew's Cemetery this past weekend, and doing so without a mask. I was there to honor the dead and their families, not to stage a publicity stunt to show how politically correct I am. I've been very clear that people should use their own judgment in wearing masks. I'm not going to tell people when to do it or when not to do it. I was in the fresh open air and sun of a park, a cemetery to be a matter of fact, and a mask was not necessary in my opinion. It's completely different than being in a closed capacity such as a SEPTA bus or something similar to that. The people who really need a personal protective equipment are the healthcare workers and long-term care facility employees. So that was uncalled for to lecture me and lecture the residents of Montgomery County and try to scare them that a mask is necessary to be outside. I was in contact with Commissioner Lawrence 2 weeks ago, and I'm not aware of anyone else that took the test following his diagnosis of being positive that also tested positive. As far as I am aware, no one else tested positive. So that was an uncalled for cheap shot, and it's an attempt to scare the residents of Montgomery County. And I know the residents of Montgomery County have had enough of all this nonsense. And with that, we can end this conversation.
Thank you, everyone. We will see you tomorrow at 3. Have a good evening.